Africa. This is HealthAfrik on the AAU TV. AAU TV is the voice of higher education in Africa. Today on HealthAfrik, we are continuing the discussion on coronavirus. And with me in the studio is Dr. Prince Opong Kyekyeku. He's with the Lebanon Community Hospital and he is the medical officer in charge. He has a lot of information on coronavirus and I know you are interested. So please stay glued to your TV and let's watch this, learn and enjoy it. I am Bridget Ama Denteh. Do stay tuned. I'll be right back. You're welcome back from that short break. As I told you, we are continuing the discussion on coronavirus and it's going to be very interesting. Let me introduce my guest one more time and I know we are going to learn a lot today on this show. Dr. Prince Opong Kyekyeku, you're welcome.
Thank you very much.
It's a pleasure to have you here.
It's my pleasure too.
Okay, so today we are going more into coronavirus. There's been a lot of talks, research, a lot of things we find on the internet. Yes, so today we want to know more. What happens after the virus enters your throat? What happens from there?
Well, once the virus gets into your throat, one way or the other, it finds its way into the bloodstream. And then as it gets into the bloodstream, it causes a whole lot of inflammatory reactions. I mean, it causes your body to produce a whole lot of antibodies, a whole lot of mechanisms that brings about the production of some chemicals in the body we call mediators of inflammation. And then these mediators, as they try to fight the infection, also in a way destroy the inner lining of the blood vessels. And then as the disease progresses, it gets to your lungs. And then as it progresses, you see that there are damages in the lungs as well. Now with the blood vessel issue, all the organs in your body have these tiny, tiny blood vessels we call capillaries. Okay. Yes. But then the lungs are the organs with a rich supply of these capillaries. Now, as the inner linings of the blood vessels are damaged, it is the lungs that are mostly affected. Mm-hmm. Yes. Now, with coronavirus, it hasn't really been seen. I mean, the kind of disease progression for coronavirus is not typical with the other pneumonias that we see. Yes. So what happens is in the initial phases, the lungs are seen to be normal. Okay. In the initial phases of the disease, the lungs are seen to be normal. You do a chest x-ray and you see normal findings. But as it progresses, it gets to a point that your lungs collapse or your lungs becomes, filled with fluids and then collapse. That is where they go into the stage of, needing mechanical ventilation to support the oxygen levels in the blood. Okay. Yes. So, researchers that have been done so far are coming out with findings that the virus in itself causes inflammatory reactions that affect the inner lining of the blood vessels. That is why people are saying it's a disease of the blood and not of the lungs. But it's, in the first place, affects your blood vessels before it gets to your lungs. And it's your lungs that are affected most when it happens like that. Okay. Yes, so that's what happens. And then a lot is being learned about the progression of the disease. It's still a new virus that we are all learning about. So a lot is being researched into the progression of the disease. So that is the little that is known. Initially, it affects your blood vessels, the inner lining, it damages it, which in turn affects your lungs. And then as it progresses, it gets to a point that it affects all the organs of your body, your heart, your kidneys, and then sometimes your liver or your brain too may be affected as part.
Wow. And then before we started, we talked about the fact that people on ventilators are given different levels of oxygen. I would like you to brief us about that.
Yes. Now with the ventilator issue, with the coronavirus, as I said earlier, it's a disease of the blood vessels. It affects your blood vessels first before it gets to your lungs. Now, what is still being probed into is the fact that in the early phases of the disease, you would see people breathing normal. They don't struggle for air. You wouldn't see any abnormal changes in their lungs. But then you check their oxygen level, the oxygen level in the blood, and you will see that the oxygen level is low. So that's what has been, happening. But then the issue is that for any pneumonia, it normally affects a part of the lung or either affects the whole part of the lung. So it is if that part of the lung is damaged, the blood vessels within the lungs rather channel the blood to the normal part of the lung, so that part of the lung will do the oxygen and then the carbon dioxide exchange. But with this coronavirus disease, you see that the blood vessels that are supposed to channel the blood to the normal part of the lungs are rather damaged. So they are not able to channel the blood to the normal part of the lung. So the blood keeps circulating at the abnormal part of the lung, at the parts of the lungs that are damaged. So when it happens like that, you see that, they will be breathing normal and all that. And then the mechanisms that are supposed to cause you to breathe in and out to exchange, oxygen and then carbon dioxide, is still, it's not there. It's not working properly. So you see that they will be breathing normal, but then the oxygen level in the blood is low. So as the disease progresses, it gets to a point that their body is not able to carry that low oxygen anymore. And that is when they tend to struggle for air. And as that happens, the damage in the lungs continue. As that happens, the organs in the body starve for oxygen. And if the organs in the body are not getting the amount of oxygen they need to survive, it gets to a point that they shut down. You get it? Yes. Now with the ventilator issue, what happens is before you give anyone air or oxygen from a ventilator, you are supposed to calculate or set the ventilator to a point where it delivers an amount of air or oxygen that will not damage the lungs. Because as we breathe in and out, it depends on the pressures within your lungs and then the pressures outside. So it is these, change in pressures that makes you breathe in and then breathe out. So when you are giving air via the ventilator, you are supposed to know the exact amount of air that the lungs would need at this point in time. You are supposed to know the exact amount of pressure you are supposed to, set the ventilator to, so that you don't damage the lungs. But in the event or in the course of delivering oxygen to these people, what happens is people tend to damage the lungs even further rather than doing them good. Yes, that is what has been happening. And that's why, it's going about that, when people are put on ventilators, there's a 50% chance that they die. It's because of these, small changes. People are in the haste to help people survive, but in turn, they tend to damage the lungs because they think they are providing them with the amount of oxygen or with the amount of air that they need. But it needs some form of expertise. Yes, there's not anyone who knows how to operate the ventilator. There are, a lot of expertise going on in that. So if you don't have the expertise and then you mingle with that, there's a high chance that you damage someone's lungs. Yes.
Okay. I have a question on nose masks, but I just remembered. When you are going to be tested for coronavirus, they put this, whatever it's called, in your nose. Why can't they use the blood? The nose thing is very uncomfortable.
Okay, so those are, we call them swabs.
Okay.
Yes. They put it there because, as this disease is known to affect your respiratory system most than other systems. And then it's been known by research that the viruses are concentrated mostly in the nose and also from your sputum.
Okay.
You get it? Yeah. So once they put that swab there, whatever substance they pick, the chance of getting enough viruses or, the RNA of the viruses in that sample is higher than going into your blood. You get it? So with the nasal swabs, when they test with the nasal swabs, they get a lot of viral RNA than, let's say, and your sputum too is also another sample that gives a lot of the viral RNA. Now, the blood, in the initial phases, you may not get enough RNA.
So you might
enough,
think there's
yes,
nothing there.
you might think there's nothing there, but there may be some, some disease or some infection ongoing. And then it's also been found that feces, yeah, this virus has been known to also affect the gastrointestinal system. And then it's also been found in the feces of people who are infected. Yes, the viral RNA has been found in the feces, but looking at the sample, percentage-wise, the viral RNA are more in the nasal swabs than the feces and then the blood as well.
So if a person uses the washroom and flushes and it goes to wherever it goes, it's still there?
Yeah, the
If the
virus will
person
be
is
there. The virus will be there, but as you said, they also have a lifespan, kind of.
Okay.
Yes. So they have, on surfaces, they have a time that they can survive on some surfaces. And then it also depends on the temperatures. They can't survive under some temperatures for a period of time. Yes.
That's some good news then.
Yeah.
Okay, but we are told to wear nose mask. This nose mask protects your nose, your lips, and then maybe this part of your face.
Yeah,
but then the virus falls on maybe your cheek and then it finds its way into your bloodstream. How protective is the face mask then?
Well, with the face mask issue, it's protective, but not entirely. Yes, as we always say, the virus spreads through droplets. Droplets in the sense that someone with a virus or someone who is infected may cough, or as they speak, the droplets that comes out of their mouth, or as they cough, the kind of particles or droplet particles that comes out of their mouth contains the virus. So let's say you are close to someone who is infected and they speak and then, or they cough. As these droplets, gets close to you, there's a high chance that you inhale the droplets, or there's a high chance that some of these droplets may settle on your eyes or the mucous membranes of your mouth. And as that happens, you may get infected. Now, with the nose mask, initially it was being advised that people who were infected should rather wear the nose mask. And that was because if someone who is infected wears a nose mask and they cough, the particles may not come out as much as they are not wearing the face mask. And that reduces the amount of particles or amount of viral RNAs that come out. You get it?
Yeah.
But now it's being advised that everyone wears a face mask because, one, it's been seen that not all the face masks are protective. Not all of them. Some of them are protective. And then we are also advised to observe social distance because even though, as much as most of the face masks are not protective, once they cough, even though it reduces the number of the viral RNAs that come out, well, some are able to travel for, some distance. But once you observe social distance, they are not able to travel a distance of like 6 feet or 2 meters. So it is advised that even though you wear your face mask, you still observe what social distance. You get it? Yeah. All because some of the face masks we wear, example, the cotton face masks are not that protective. And some of the surgical masks people are saying are not really protective. There's one that is, protective. We call it the N95.
Okay.
Yes. But once some of these face masks are not that protective, it is imperative that we also observe the social distance. So that even if the face mask is not giving you the protection that you need, at least the social distance would add to the protection.
Because we all can't go about wearing face shields.
You get it? Yes.
Okay. So now let's move to the symptoms. We all know that coronavirus patients will cough, sneeze, have some breathing difficulties and all of that. But we also know that there are symptomatic patients and asymptomatic patients. Kindly explain that for us.
Yes. So when we talk of symptomatic patients, a symptomatic patient is someone who is infected and is showing symptoms of the disease. Simply put, that is a symptomatic patient. Now, an asymptomatic patient is someone who is infected with the virus but is not showing symptoms of the disease. And I think per the researches that have been done recently, it's been found that the number of asymptomatic patients are even more than the symptomatic patients.
I see.
Yes. So that is why they tell you to wear the face mask. I mean, even when you go close to someone you don't know is infected or not, because you don't know, the person might be infected, but they are not showing symptoms. You get it? And there are a whole lot of people like that. Yes. So that's the reason why they are, telling everyone to wear face mask. Once you go close to, a group of people, because you don't know who is infected and who is not infected.
So the person who is asymptomatic can still spread?
Yes. Someone who is asymptomatic can also spread the disease, but the one who is symptomatic can spread the disease far more than the one who is asymptomatic.
Okay.
But they all, the two groups can spread the disease.
Okay.
Yes.
Is it because the asymptomatic might not be coughing or sneezing?
Yes. So asymptomatic means they are not showing symptoms. So they might not be coughing, they might not be sneezing and all that. But the symptomatic ones, once they start coughing, once they sneeze and all that, they have a high chance of shedding the virus around compared to the asymptomatic ones.
Okay, but the asymptomatic, is it because of a genetic something, or is it because their immune system is strong? How is it that they don't show signs?
Yes, so that one first depends on the time they get infected. You see, we tell people that once you go close to someone someone who has been infected, you have to isolate yourself for like 14 days. Yeah. That is because the virus has the incubation period is like 2 to 14 days, but it has an average of about 5.5 days. Yeah, so within the 2 to 14 days, even though you might be infected, but you wouldn't show any symptoms within that, number of days. That is why we tell them to go into self-isolation.
Okay.
Because they are infected, but they are not showing the symptoms. That makes them asymptomatic. Yes, and there are people with a very strong immune system who, may also have the virus, but they may not be able to mount or they may not be able to show symptoms because they have this strong immune system. That is not causing them to show the symptoms.
But then they respond to treatment.
Yes. And there are some people who would have the virus, but they wouldn't be taking anything serious. Just the vitamin C, the immune boosters and all. They wouldn't really show enough symptoms. You understand? So those people are also there. But the main idea has to do with the incubation period, or depends on the point in time that the person got the infection.
Okay.
So you have to isolate yourself for a number of 14 days. Once you know that you've come into close contact with someone who has been infected, you have to isolate yourself for 14 days. Before, that's after the 14 days is the point where it's expected that you show the symptoms. But people show the symptoms even earlier. Some show the symptoms as early as 2 days, some 3 days, 5 days. But some will go up to 14 days and wouldn't even show any symptoms. But they would still be carrying the virus.
Okay.
Yes.
That's very informative. Viewers, we are going on a quick break. When we come back, we'll come to talk about chloroquine and the way they are using it to treat patients. I'm very intrigued about that. Still stay tuned. You're welcome back. We are still on coronavirus. Dr. Prince, before we left, I indicated I would talk about chloroquine and how it's being used with treatment. How is chloroquine working? Because chloroquine has been long forgotten.
Yeah. Yes. In the first place, chloroquine, as you know, was an anti-malaria. It's actually an anti-malaria that was used way back. And it's also an immunomodulator. Okay. By that I mean it's being used for people with rheumatoid arthritis, and there's one other condition, systemic lupus. Yes. So with these conditions, it helps them. Actually, it helps with these conditions. So I mean, the chloroquine you have in the system now is being reserved for these kind of patients, those with the rheumatoid arthritis and the systemic lupus.
We can produce some.
Oh, they produce a lot.
Oh, okay.
Yes, but it's also being found that the chloroquine is, or the chloroquine has this effect on the viral replication. I mean the viral production. What it does is that it distorts the pH. It distorts the pH. The pH meaning the acidic or the alkalinity that the virus would need to produce enough of itself. Okay. So chloroquine has been seen to shift that pH more to the base side. So once it does that, the virus is not able to replicate more. And it's kind of arrest the replication of the virus at that point. So that is why it's being incorporated in the management of this coronavirus disease.
Oh, okay. But I hear people with existing health conditions should be careful. What about someone who has asthma or who has
sickle
cell anemia? Yeah.
Yes. Actually, they are all part of the people with existing conditions. Yeah. Yes, they are all part. So right now, when you go to the UK, I think they've spelled out some medical conditions, and then they call these people and tell them what to do, how to be careful, and all that. I think they have a term for it. They call them every single day. They tell them what to do, what not to do, and all that. Now, someone with asthma. Asthma is a chronic respiratory form of disease, and this coronavirus, being a disease that affects your respiratory system. If you have asthma and you get this disease, meaning it's going to be fatal. Yes. Now with sickle cell disease, anyone or people with sickle cell disease have a higher chance of getting a whole lot of infections. They stand a higher risk of getting infections. So coronavirus is not an exception. So when you have sickle cell disease, it's advisable that you take a lot of these precautions seriously, because your chance of getting infections are way higher compared to other people. So they are all part of them. I mean, sickle cell, asthma, those with hypertension, heart diseases, the cancers, diabetes, and all that. They are all part of them. So those with sickle cell disease and then bronchial asthma are not exceptions.
Back to treatment. I read somewhere taking aspirin immediately you start feeling symptoms, kind of suppresses the symptom. Immediately you start feeling symptoms, kind of suppresses how fast the virus grows within you. Is it true?
That one too is also still under research.
I see.
Yes, I think it's some people started doing that and they thought it helped them.
Okay.
Yes, but when you go, WHO has spelled out clearly that people should really be careful using these NSAIDs. Aspirin is part of a class of drugs we call NSAIDs. Yes, now what NSAIDs do is that they inhibit some enzymes in the body that causes or produces a lot of inflammation. So there are some enzymes in the body that causes your system to produce some mediators of inflammation. Now these NSAIDs rather inhibit or stop these enzymes so that your body doesn't produce a lot of these things. So when your body gets, or a foreign substance, or let's say a microorganism gets into your body has a way of reacting to it. So as it produces these mediators of inflammation, in a way, your body now, starts responding by letting you get fever, some slight headache and all that. So when you take your paracetamol, when you take your aspirin, when you take your diclofenac and all that, they rather go to stop that process. You get it? That is why people get fever, they take diclofenac, they take aspirin, they think they are fine. Yes, they stop that process. Now, aspirin also has been found. Aspirin is not just an NSAID. It also helps in this process that it helps in. It's also an antiplatelet, meaning it inhibits platelet aggregation. And then platelets are a part of the blood components that when they aggregate, they causes a whole lot. They cause your blood, to clot and then block your blood vessels, which lead to a whole lot of, complications. That's another topic for another day. But then aspirin is also known to do that. So mostly people with heart conditions, we also put them on aspirin so that it helps their blood to flow freely. Yes. Now, per some of the researches that people are publishing, it's been seen that aspirin also has some effect on the viral replication. The virus producing itself a lot. Aspirin has some effect on it. And that is why people are dwelling on aspirin as part of the management. But it's also, people are also doing a lot of researches as to the side effect or as to any untoward effect that may come out of using these medications. And they are not really recommending the use of aspirin or the use of chloroquine for the management of coronaviruses. Yes. And we should also bear in mind that once, it's a pandemic, and there's this kind of hasty need for a treatment method for, the whole disease. And that is why any kind of treatment that someone uses and think that, oh, this is helping, people try to dwell more on it. But in effect, there hasn't been a lot of research works done on these things. So even though they may be giving you some benefits, they may also be giving you a whole lot of untoward effects, a whole lot of side effects that people are not looking onto. We are all looking at the positive side of it, but they are also creating a whole lot of negative symptoms. Chloroquine was being used for the management of malaria. It was working, but later it was found that it has this, side effect that may affect the eyes and a whole lot, and then it had to be dropped. You get it? So people are looking more onto the positive side, and then they are neglecting the negative side of it, which wouldn't be the best. There has to be a whole lot of research work on it to be able to find the good side and then the bad side, so that we can recommend that, oh, you can use this drug for the treatment of COVID, and so on and so forth.
Okay, now let's move to COVID-19 reinfection. People are not aware that people think it's like chicken pox. So you get it once and you are done.
Yeah.
But then there's reinfection. How does reinfection occur?
Okay, so as with these respiratory organisms, is it common cold? Is actually a viral disease.
Yeah.
And then common cold is caused mostly by some of these coronaviruses. Okay. Actually, the other coronaviruses that we know, most of them cause common cold. And you see, with common cold, you can get cold today. And if you don't take care of yourself very well, in a week or in 2 weeks' time, you can still get the cold. You get it? But it's a viral infection, and then most of the time, your body produces or your body fights the infection. So sometimes you will get cold, you wouldn't take any drug for it, it will go by itself. That's because your immune system is able to fight it. Now, it's the same with coronavirus. You may be treated, you'll be perfectly fine.
Tested
but
twice.
If you don't take care of yourself very well, you might also get a reinfection. You might get infected again from it. You get it? But then it all depends on your immune system to be able to fight the infection again.
Okay. And then antibody testing for coronavirus. What is antibody testing?
Well, now with the testing issue, there are two forms. We have the diagnostic test, and there's one we call the serologic test. Now, the diagnostic test is the one we do to find out that someone has an active infection, that you have the infection now. But the serologic test, otherwise called the antibody test, that one is done to know that you've had
it before.
Yes, you've had the infection before. Now, with the diagnostic test, when we do that test, what we are looking for, and that is what mostly we use the nasal swabs, the sputum, and then sometimes they go deep into your airways and then take samples for the testing. Those are the ones we do to know that you have an active infection. You have the infection right now. So those ones, when we do, we look for particles of the virus. We look for the viral RNA. So when we see that in those samples, we can say that, oh, you have the infection. But the antibody testing normally uses the blood for the testing. Now, you see, once you get the infection, your body fights the infection, produces antibodies against it. The antibodies are like proteins. They are proteins in the blood that your body produces. Whenever a foreign substance comes into your blood, these antibodies would see this foreign substance as, no, you are foreign, you don't have to be here. And they will fight and then kill it. You get it? So anytime a foreign body comes into your body, that is what your body does in responding to it. They produce antibodies. Now, the antibodies, once we do the test and we detect that you have an antibody against coronavirus, it means that you had the infection and your body was able to fight the infection. So your body produced antibodies against it, and the antibodies are going to be there. So that whenever you get the infection again, your body, the antibodies will be like, oh, this virus, you came here not long ago, we fought you are here again, they will kill it.
Oh, okay.
You get it?
So it's not like the virus is still in there.
No, the virus wouldn't be there, but the antibody will be there.
Okay.
And the antibody, they have memory, so that once the same coronavirus comes into your blood again, these antibodies will be there. They are going to fight it. So it's with every infection. Once you get the infection, your body produces antibodies against it, and the antibodies remain in there. So whenever we do a test or whenever you take your blood sample, we look for those antibodies, and it is that antibody that will tell us that this person had this kind of infection some time back. So that is with the antibody testing. It's just to find out whether you had the infection or not. So when we go into your blood, we do the test, and we don't find any antibody there, it means you haven't had any coronavirus. But if we see the antibodies, it means you've been infected before.
And that is
yes, That is the antibody testing.
Okay, that's a lot of enlightenment. Thank you. We are wrapping up here, but I want to know, can a breastfeeding mother with coronavirus transfer to the baby?
Well, no.
No.
Yes, per the researches that have been done, none of them published that the viruses were detected in the breast milk.
Okay.
None of them published that. And so they advise that even if you are a mother with an infection and you give birth, you can breastfeed your baby there and then. But you need to take precautions. You have to wear your mask, wash your hands, sanitize your hands.
But you can't social distance your baby.
No, as for that one, you can't. So you have to make sure whatever means of contracting the virus doesn't get to your baby.
Okay.
But you can breastfeed your baby immediately as you deliver.
Okay.
Yes, there are no evidence as at now that the viruses are detected in the breast milk. No.
Okay. Well, as I said, we are wrapping up. I'd like you to, a word of caution. You know, there's a lot of stigma going around.
Yeah.
There's one in my area, and people don't want to sell anything to him. And the nurses, when they come back from work and they are passing, you can see that a lot of people are just giving shoulders and all. A word of advice to people stigmatizing against, even nurses and then patients who have recovered.
Yes, what I would say is that, coronavirus is a non-respecter of persons. Yes. It doesn't matter even if you are the president of Ghana, even if you are whoever you are, you can still get the infection. So, this is the point that we have to hail people, who have come out of this infection. They've done well because there are a whole lot of people dying from this infection. So if someone goes to the hospital, tests positive, and then they come back home and then they test negative, we are supposed to even hail them. We are supposed to, we are supposed to praise them, let them know that, yes, they've been able to fight the disease. But this is not the point to stigmatize. This is not the point. And once you stigmatize, you kill their soul. It brings a whole lot of depressive issues in the background, and that wouldn't help at all. And I forgot, there's a new name for the disease. Fine, the disease is called COVID-19 or coronavirus disease, but the virus itself has been named as severe acute respiratory syndrome coronavirus 2.
Oh, okay.
Yes, that is the name given to it now. And there was a whole lot of discussions that went on before that name was given, just to prevent sort of stigmatization as to where the virus came from and a whole lot. Yes, so that's the new name for the virus: severe acute respiratory syndrome coronavirus 2.
Severe acute respiratory syndrome coronavirus 2. That's a long name. All right, your final words.
Well, my final words would be that there's still hope.
There's still hope.
Yes, there's still hope. Yes, even though a lot of people are dying, but we should encourage ourselves, and then we should observe all the precautionary measures. That is the way we can, defeat this virus. Other than that, it's going to be fatal. But there's hope. Whatever the case, this virus can't stay with us forever. Yes.
You can't.
Yes, we'll defeat it. And I believe so.
All right. Thank you very much, Dr. Pence. It's been a pleasure having you in the studio. We've brought the conversation to an end, and it's been very interesting. I know you've learned a lot. At least we've learned a new name. Yeah, the new name given to coronavirus. So don't forget it, as I have forgotten right now. Severe acute respiratory syndrome coronavirus 2. Thank you very much for watching HealthAfrik. My name is Bridget Ama Denteh. Do well to follow the conversation on Facebook, YouTube, Twitter, Instagram. Thank you, and see you next week.